Fazana, can you co-host me so I can start? So good evening and welcome to Wisdom Wednesdays. My name is Carol Tozer, and with me on our panel are my usual buddies, Fazana Khan, Soraya Dean, Selvi Sachitanandam. And in addition, we have Devya with us. She's going to be our guest speaker for today. So on our journey to bring you wisdom wellness, we have presented practitioners who elaborated on their respective methods of healing. We were able to see that all their methods had a common thread running throughout. That was advocating a complete change in lifestyle for healing and well-being. It appears that our present lifestyles are contributing to most of our society's ills. We seem to have got it wrong somewhere along the line, although our forefathers were able to live much healthier lifestyles. They highlighted the lives devoid of relationship to nature, our inability to live without stress, and our excessive dependence on pharmaceutical drugs. So let's move on to our panel today, because it's going to be a very interesting discussion, and to find out what they think of today's topic, lifestyle changes. Over to you, Selvi. You want to start?
Thank you, Carol. I'm really happy to be here today. I would like to say that we have benefited immensely from meeting all the other practitioners we have met before. And there is a sort of a thing that everybody talked about is nutrition. Mostly nutrition, what to eat, when to eat, how to eat, and using food as medicine. And another set of ideas that came across was self-introspection and spirituality. And another one was going back to nature. And most importantly, they talked about removing stress. Because what they said was, absence of disease is not health. And even if you have health, if you have stress, you still are not enjoying well-being. So after everything that you do, you have to remove stress from your life in order to be well and to have wellness in life. And for that, I think it is so important to remove trauma from our body, from our mind, and from our emotions. And that's where we are here today. So let's proceed.
Thank you, Selvi. Fazana, would you like to go ahead?
Yeah, Carol. So I think in the last, 10 programs or 9 programs, we've discussed various aspects of lifestyle change. And I think with COVID also, if people can't bring this to reality, it would be really sad. And for me, what struck most was getting back to nature. I mean, in the good old days, life was much more simple. We didn't have these concrete jungles and, artificial packaging and foodstuffs that we have. So, spending more time in the jungles and the parks and the rivers and doing hikes, doing some gardening, walking barefoot in the garden, absorbing enough sunlight and, living in nature with fresh air, was what struck me the most, apart from all the other areas where we learned from on food habits, yoga, acupuncture. We had quite a lot of learning, and I think we really need to embrace at least bits and pieces of this. Maybe we can't change overnight, but maybe at least in a gradual way we need to get to this journey. Yeah.
Thank you, Fazana. Soraya, you have something to tell us about what we are talking about today.
Yes, yes. I think Fazana and Sylvie have summed up beautifully what we have learned so far. And I'm just wondering how many women, particularly women and men, of course, who are on the show who made any lifestyle changes. As for me, I incorporated some healthy food habits, eating more greens and fruits. But I'm very excited for today's topic because trauma, I think, is a women's health issue. And our program was geared and is geared more towards empowering women and, of course, men to be healthy, to be robust, and to work towards creating a united world. They say there are wounds that never show on the body that are deeper and more hurtful than anything that bleeds. So I think as women, we know we carry much of those wounds, and I'm excited to engage with our guest Divya, who is an expert on this topic, and ask her what the impact of trauma is on our bodies. And I think this will be a great not a culmination, really, a great moment for us to really bring everything we learned and cleanse our bodies. Thank you, Carol.
Thank you, Soraya. I want to give a special shout out to the men, the strong men who join us on our shows, because I think they are the ones who can also effect change in some of our lives, and I really, really have to say I appreciate it, because although this is a show to empower women, I mean, we need the men along for the ride as well. They'll have something important to offer. So anyway, to get on with today's show. So Divya is somebody I've been seeing for a while. And I found to be extremely helpful in my life, in changing how I think about things and how I challenge stress and how I deal with day-to-day life in all the different areas that we all work in. So in order to discuss these important lifestyle changes that were discussed previously by some other practitioners we had on our show, today with us, we have Divya Sivanesan, who is an acupuncturist, a trauma healer, a yoga instructor, and I'm told she's a Vipassana meditation enthusiast. She believes deeply that lifestyle changes are key to human well-being, but this is possible only and if we have addressed trauma healing first. Divya is someone I have been seeing, as I said, for the past year and can highly recommend. However, I must add that there is a huge demand for Divya. Everybody I know goes to Divya. Everybody I know wants to go to Divya. But it's hard to get an appointment sometimes because she's a very busy lady. But the good news is Divya has a vision for setting up a college for training graduates in acupuncture. This is classical acupuncture, and yoga classes at her practice at Purnam Center. So I'm very happy to introduce you all to Divya and let her do the talking now. Over to you, Divya.
Thank you, Carol. First of all, thank you so much for such a kind and generous introduction, and it's such an honor to be here. Thank you so much, Carol and Fazana and Soraya and obviously Selvi, for giving me this platform to come and share my experiences and my reflections on basically trauma and healing and wellness. So I'm here to kind of talk about how it's really, so we've been you guys have had amazing sessions. Again, I'm so happy to be with the 40th session here, about different aspects of how you can change, how lifestyle changes can affect wellness. So one thing I'd like to kind of focus on in this session is how trauma healing itself is a kind of lifestyle change, and how it's something that we all need to embark upon, and how important it is to do as a structured kind of proper framework journey that we all need to be on, rather than just keeping it to a side and, oh, that's for somebody else, not so much for me. So I'd like to kind of divide my talk up into three. So I'd like to talk about why trauma healing is important to wellness, and how it's important as a lifestyle change in and of itself to just, look at that. And the second aspect is, how one can actually heal from this trauma. And I'll be bringing in some experiences and reflections as an acupuncturist. And the third aspect will be how, what are the concrete next steps we can take as individuals to go about this. So why is trauma healing important in wellness? So I think this is something that I have to say as a personal experience, because when I went to Chinese medicine school, basically the emotional aspect is not divorced from the physical. They're both one and the same. And yes, I learned this theoretically, and so much of it is, combined. They're so integrated. But I think my real experience came when I actually started practicing. And what I started realizing very early on in my practice was, people would come in with sort of physical symptoms, and I used to treat it, and it used to go away, but then it used to come back. So this was like my first 6 months of treatment. And in my mind, I knew this is emotional stuff, and, it's their problems with their father, because I studied all of this theoretically. But then as my practice started going on, like as I started getting deeper in my practice and I started getting more experience, I was thinking, okay, so why am I just treating things? Why can I not also integrate a concentrated emotional approach as well? Because yes, I do integrate it into my clinic consciously, but I don't necessarily communicate that or focus on that for the patient. And when I started doing this, and so two and a half years ago, I started focusing a lot more on drawing in the patient to actually focus on their emotional health. And I started giving them exercises and homework. So I really brought in a new element to my practice. And when I started doing this, the whole thing, it was a game changer for me, because my whole practice just turned around, and in terms of the deep impacts the needles were having, and people just started having paradigm shifts. So it's fascinating to me, because when I started this new approach 2.5 years ago, 3 years ago, of integrating kind of emotional trauma, focused emotional trauma healing in my clinic, a lot of people were saying, oh, no, I'm fine. I don't have much trauma. I had a happy childhood. It's all fine, normal ups and downs. And because we always tend to think that trauma is something very, it's very kind of, it's a big thing, like going through a war or getting sexually abused or having violence. But trauma but what I've experienced in clinic is that trauma is something that everyone goes through. Like it could be something from feeling that your parents favored your sibling. It could be a breakup that you went through. It could be something horrible that you went through at work. Part of being human is going through ups and downs. But we were never taught in school how to emotionally heal from the downs. And this is something we all have. And all the small issues that we have gone through from childhood to adulthood, these leave imprints in us. And they have reverberating impacts across society. And it's really important to address this. And it's not just someone who goes through war and has lost 3 children. It's all of us. And this is something that we have to look at. And because it doesn't just impact you, it impacts your children, it impacts your partners, it impacts your work colleagues. And actually it impacts, like, just your actions impact the entire planet. So I know that sounds really kind of far-fetched, but just if you think about it, if you're a boss and you shout at your subordinate, and the subordinate now is very agitated, now he gets into his car, he starts driving, he might start driving erratically because he's remembering the humiliation that the boss gave him, and then he crashes his car. The other person, in the car that you crashed, has to go to hospital. They can't pay the medical bills, so they have to ask their relative in the United States to pay their medical bills. So you can see like how one action, the boss shouting at one employee, can have ripple effects through the entire, throughout the universe, throughout the planet. So if that boss had just done a bit of emotional healing, that would have basically curtailed that entire chain of events. So it's really, this is really important work. And it's not just about you feeling better, but it'll have ripple effects through the entire, the whole planet, because we don't know the chain reactions that each one of our individual actions kind of set into motion. And so the thing is that when you have these wounds in you, when you have these core beliefs, when you have these feelings of rejection and inadequacy, it starts coloring how you look at the world, and it starts coloring how you respond to things. So let's just say, for example, you had a bad experience with a friend betraying you. And then you walk into a store and then you see someone who looks like your friend, who talks like your friend, or or maybe a better example was in your office and the new person looks like that person or sounds like the friend that betrayed you. Immediately something is triggered in you. It might not be conscious, but it's definitely there because you remember with a full visceral kind of memory, the impact that betrayal had on you. And then you start interacting with this person, maybe without even knowing it, with a bit of suspicion, or you might be passive aggressive, or you might be overtly aggressive, right? Because it's not to do with anything the person did, but it's to do with the experience that you had before that you are now bringing to this experience. And so because we're all sentient, sensitive beings, the other person also starts dancing to you because the other person feels, why is this person being like this? Or why is this person being aggressive? Why is this person, being suspicious or, withholding information? And then you start this toxic dance, right? And so this is how drama starts. This is how so many kind of acts of violence, it doesn't have to be hitting somebody, but even just, how these things just get started. Because one person didn't heal the wounds that they had from an experience that they might have had 5 years ago. So the whole point of kind of trauma healing, therefore, is to see the world as it is, rather than looking at it through the lens of your wounds. Because once you start looking at things through the lens of your wounds, you are superimposing your past experiences on to the person or the situation in front of you, and it might not be the real thing, because that person that you might have had an issue with office because of something a friend did to you might be an amazing colleague or an amazing friend, a future lover, but you never gave it a chance because you were looking at this person through the lens of your last experience. So this is a thing. So it's really important to really focus on this. Like, we all have something. We all have something that we need to heal. There's not one person on this planet that has nothing. So to incorporating emotional healing into your lifestyle is absolutely important. And it's a responsibility and it's sacred work. And I really think that if everyone just did this in a concentrated way, we would really have, or we'd be definitely well on the way to world peace, because we would be a lot less violent towards each other because of what's going on in our own minds. So the second part is like, how does one now start healing? And, if you've been here with these wonderful ladies the last few months, you would know that, there are so many different interventions. They've talked about homeopathy and naturopathy and all of these wonderful things. So in this session, what I'd like to focus on is, as an acupuncturist, I'd like to bring in body healing and why that's important. And not to say that the other things are not important, but because this is my experience. And this is one of the interventions that you can use to heal emotional trauma. So I would like to kind of start talking about how body therapists, so body therapists could be, anything from drama therapists or homeopaths or any kind of therapy that uses the body for emotional healing. And why is the body important? Because definitely in Chinese medicine and in yoga philosophy, the body is an ocean of memory. So actually, like the memory is not actually so much in your mind, but it's held in the body. So it's stored in the body. So for an example of this would be, if you think about like a child that's experienced violence, and every time, their father came in and was violent, he could have been clenching his stomach or tensing his throat or clenching his hands. So that's now become a body memory, because every time the father comes in, that is their response. So how does this then translate into now the physiological problems? So now imagine a child, every time the father comes in, he's clenching his stomach. And now every time he goes out and then he watches a movie that reminds him of that experience, or he hears something, or he watches something, or he smells something, like his father's aftershave, or somebody who has the father's aftershave, he will clench his stomach. Now imagine a child doing this 15, 20 times a day for about 10 years. What's going to happen to circulation in your stomach? What's going to happen to circulation in your throat if you're constantly tensing? So we're talking about if you're tensing your throat as a body memory, so you have that body memory of that trauma is in your throat. So you're constantly tensing it up. So what's going to happen to circulation, to the thyroid, to the teeth, for example, to the lungs? You know, this entire blood circulation starts getting cut off, and that's when you start getting all your physical problems, right? So it's really important to start healing from the body, because that's where it lies. So what we tend to think about is healing from the mind, and the mind is also important. So when you go to a therapist and you start talking about your problems, of course, it's important. You're sorting things out. You've been through a terrible marriage, and then you start thinking, okay, now I understand what happened. But that's not the complete healing. Because if you meet someone that looks like your ex-husband or starts talking like your ex-husband, your entire, like you might think in your mind, because your therapist said, I understand, I have to forgive this person, I have to let things go. And you understand it completely logically. You completely understand that, and you know this is what you have to do. But why is it that when you meet that person again, or you see someone that looks like that person, your entire body goes through a physiological reaction? Like you might you might start sweating, you might start losing your voice, you might start clenching your fists, because the body hasn't forgotten it. So it's really, really important to start healing through the body. Like the mind is great, and that's a really important thing to do in parallel, but the deep healing is really in the body. And when you start healing the body, you will notice that so many of your chronic ailments, so many of your aches and pains. Now, I'm not saying that all aches and pains are a result of emotional trauma. It could be due to surgeries or medication or whatever, but a lot of it is. And this is something I have personally experienced in clinic over the last 6 years. Just when you start healing through the body, you start putting needles in people, and you start guiding them through conscious exercises on how to heal, on how to actually get rid and deal with these body memories. Their lives start changing. It's phenomenal. It's absolutely phenomenal. Just in 2 months, the person puts in that work and their entire life changes. So yeah, and so for me, then healing through the body is something that is absolutely, I mean, obviously I would say this, I'm a body therapist, but yes, I would definitely say that healing through the body is very, very important, because that's where all the memory is. So yeah, so I think that, so just to conclude, I think that, yes, so when you start deactivating all these body memories that your body is holding from previous grievances, previous traumas, hurts, pains, betrayals, you will start the whole body, the connective tissue that's bunched up, the child who's been through emotional abuse, and therefore the adrenals have been kind of pumping at abnormal rates, and therefore they've got kidney issues and back issues. They start immediately start reversing. You start getting blood flow and circulation back to the body. And it's amazing how the body just suddenly gets back online after all of this. And when this happens, the body starts radiating health, wellness. You start kind of channeling kind of the body intelligence, which was before numbed by bunched up connective tissue that was always tensed up like this because of anxiety. And then you really start thriving. I think somebody here said, it's not just about living, it's about thriving and doing so well in your life that you're not just kind of pushing your body through life pain-free, but it's more than that. You're thriving as a human being. So what can we do concrete steps-wise? I would really invite you to kind of start looking at your body as a repository of memory. Every single thing that's happened to you from birth till now, unless you have done conscious work, is still in your body. So if you start looking at your body as a repository of memory, that itself is like a huge first step. And then I'm not here to say which therapy is better. Obviously, I'm an acupuncturist. I love what I do, but there are so many other types of body therapy that you could choose. I would suggest meditation. There are so many different types of, body meditations that one can start to start healing the body. And really start kind of putting in concrete and consistent things and as a priority to start healing yourself of trauma. And this is not just left for people going through war or like painful, abusive divorces. This is for all of us. And I really do think that once we all start working on ourselves, the whole world will change. And I sincerely believe it from what I've seen in my clinic. So yeah, I hope that was a bit comprehensive. I've just given a very brief introduction of things. So yeah, Carol, over to you.
Thank you, Divya. I have a two-part question for you. One is what you're saying is some of this memory that you store in your body, bad memory, can actually manifest in disease, right? And that's one. And the other one is that what is the difference? Because, in Sri Lanka, when you said acupuncture in the past, we all thought of the traditional acupuncture where they just stick needles in you and tell you that you're going to get better in some disease or the other. But what you do is classical acupuncture, right? And so if you can explain to everybody, what it means actually, what the difference is.
The difference between classical and traditional?
Yes.
Okay. So yes, I practice a style of acupuncture called classical acupuncture, which I think there are just 3 or 4 classical acupuncture colleges in the world. So we're very, very much a small segment. I would say that 95 to 96% of people practice traditional acupuncture, or TCM, as we say. And again, I'm not here to say which one is better or worse. It really depends what works for you. But the difference here is that, so classical acupuncture was the ancient acupuncture. It dealt with the ancient classical texts, primarily the Neijing, which was written 2,000 years ago. So we were considered the ancient surgeons of China, and we were treating all kinds of kind of complicated, serious illnesses. We were factoring in climates, we were factoring in the movements of planets and how they affect your body through climate. We were looking at the emotional aspect, which I studied, which I'm bringing to my practice here. So all of those things were brought together. So it is a very much a tailored approach to treating one person. So we didn't have a set of protocols for gastritis, for example, because everyone had gastritis for a different reason. So I can't treat gastritis in 5 different people the same way. So then what happened was when the Cultural Revolution happened in China, Mao came in and he looked at the whole medical system, and then he said, this is not in line with communism. It's too woo-woo, it's too airy-fairy, it's too spiritual, it's too cosmic. He had all these opinions of what communism was, and he wanted to be very allopathic or Western medicine in its approach to medicine, which is completely atheist, completely communist in his outlook. So he reformed acupuncture to make it more aligned with Western medicine. So TCM, that's TCM. So TCM kind of came into play in the 1960s with Mao, and they work very much according to protocols. So if you go into gastritis, there'll be a protocol of needles that they do. And so you can see that it's equating the acupuncture point to a pill. It is still loosely based on the classics, but it's still very much a protocol-based medicine. So if you have gastritis or asthma or whatever, there are about 10, 15 needles that you put into the body. And this has worked fine because, obviously, like for the last 60 years, it's still in circulation. But compared to how classical therapists would work, it's protocol-based versus very tailor-made, and bringing in lots of environmental and constitutional and emotional factors into the equation, and it's very much older than the
Divya,
TCM.
I have a question. It's more of a hypothetical. I work with a lot of women who have been victims of trauma and violence. So this is the story of a woman. She says, whenever the door is banged, she has this trauma, you know, because her husband used to beat her and bang the door.
Right.
She has divorced him since, but then she has this trauma. And you said the body is a repository of memory. We think it was the mind, but you're saying it's the body, the gut feeling and all of that. So hypothetically, what would your advice be? Should this woman replace that fear with a positive thought? Should she just recognize it's a negative thought? How would you advise a client if she is with you? How does she replace this memory?
That's a fantastic question. Thank you, Soraya. And that's something we've all experienced. I mean, not the abuse as such, but definitely like when you hear a sound, your body goes through something. It could be a good experience or a bad one. So especially if it's something as, as serious as abuse and you hear a door bang, what I would suggest to this lady is, because the immediate thing is, oh my God, and you go into this, you go into emotional shutdown. What I would suggest is in that moment, go into your body and analyze what's happening to your body. And is your heart beating? Is your palms sweaty? Is your throat going numb? Because that is where the body memory is. And we all react to these things in different ways. Some of us might clench up, like pelvis or hands or whatever. Notice what you're doing to yourself. Because just that mere act of observation starts healing. This is a very basic thing, and I don't think it should be done on its own. It should be definitely kind of complement with other types of therapy. But definitely, I would suggest to that lady, do the body scans, find out how your body is reacting, get to know your body. Obviously, I'll tell that person to come for acupuncture, but maybe also definitely kind of direct her to, refer her to other types of therapists who work with the body, maybe movement therapy, some sort of drama therapy, some sort of homeopathy, something that will release the trauma from the body. Because once you've identified where it is, then you can start working with it.
We have a question from one of our viewers here, Fazli. He says, is fear experienced since birth the basis of trauma?
Sorry, I didn't understand.
It says, is fear experienced since birth the basis of trauma?
Absolutely.
Can it be a basis?
Absolutely. I mean, babies, we think that we think they're less evolved because they can't talk, but babies sense and fear everything. And from the time of birth, even from the time in vitro, actually, there is body memory starting immediately. So everything that baby experiences, whether it's not being picked up or there's violence in the house or shouting or substance abuse, that baby picks up everything. And that baby is forming a core belief in the body about how to respond, how to then go about life. And it's also coloring that baby. And when it becomes into a child and a teenager, an adult, how to then, and so maybe if they'd experienced, shouting as a child, when they hear shouting, the body trauma is immediately triggered and something happens to them. So
That's
absolutely.
There's another aspect of it, right? Not only does the trauma shut you down, but on the other hand, it can be a circle of life.
Absolutely.
Unless you actually deal with that and acknowledge it for what it is, you could then go on to be that trauma creator, right? When we have abuse, physical abuse, sexual abuse, could it be that, since you haven't healed yourself? Yeah.
This is exactly true.
Okay, Divya, another quick question, if I may. My panel is also waiting. I think I learned that there are several types of traumas. One is from a single incident. They might call it acute. Then there's chronic, repeated. Every day this is happening and trauma has built up. And then there's complex, where Several types of traumas. Would you suggest that we do the same thing in all therapies for trauma?
Absolutely. I mean, obviously if someone comes in here if someone came into my clinic because they're going through a painful divorce, or they feel that, they're not getting on with their family, I would treat them differently to, someone who's just come in from, who's experienced complex conflict, and they've had their house bombed and moved multiple times. I mean, obviously the extent of trauma is different, but the philosophy is the same. The philosophy is deal with the body, deal with where that you feel that trauma in your body, and go from there. And I do a specific technique in my clinic to help people deal with this. I'm sure there are so many other techniques. And it's just kind of shopping around and seeing what works for you. But yes, I would deal with, obviously, the different types of trauma, but I feel like the philosophy is the same.
And then one last question. This question is quickly for my sisters in the North and the East who have gone through the horrendous impact of a 30-year-old war. They have grief and trauma. They have lost their children. They don't even know how they have lost their children. Are they privy to this kind of healing? Divya, do they have such healing in the North and the East? And what can we do to take it to them?
You know, Sarai, it's so funny you should say that, because that's actually why I shut down my practice in London to come here. It was a life-changing trip that I made to Jaffna 5 years ago now, where I actually did a mobile clinic up in Jaffna, and it blew my mind because because these people have been through so much that you put one needle in them, and this woman just broke down into tears, started crying because it was just one needle. And she started crying, and she started talking about everything that she'd been through in the one knee. And when she got up, she said that I just feel like a weight has been lifted, because because their low is so low that when you put a needle in them, their high becomes so high. Like it's like if they're here, and then you put a needle and it becomes this high, but then some of us who don't have that, when the jump isn't so much higher. So it was amazing for me to see that. And that's what inspired me to drop my practice in London and move back here, because I said, this is where we need to do healing. And I have plans to set up volunteer clinics in the traumatized areas, not just in the North and East, but also in the South where the army came from, because they also have seen untold amounts of things and they can't sleep at night, and they're going through all of this as well. So this trauma it's the whole country has gone through this. The whole country has suffered in different ways. And I don't know if there's anything, I think there are people doing sporadic things, but to my knowledge, I don't think there's anything based there dealing with this. And I'm desperately trying to set things up that we can have a permanent presence of volunteers doing this type of work in the North and East, because that's actually why I came back, one of the main reasons.
Thank you.
You know, when I first went to see Divya, I bopped along in there, and she asked me this question: do you have any trauma from your childhood that you can think of? Or I was like, no, I had such a happy childhood, etc., you know, as she was saying earlier. But when she dug deeper, you know, you find specific events that have taken place in your life that obviously may turn you into who you are, sometimes for the better, sometimes for the worse, right? And sometimes you have to strike a happy balance. So it was very interesting for me, because I always thought, you know, I'm this happy-go-lucky, you know, whatever happens, it's okay, I can deal with it kind of person. And yeah, so Divya managed to help me along. Fazana, do we have any questions for Divya?
I think everyone asked some of the questions I wanted to ask about childhood and even in the womb. You see, they say even when the child is in the womb, the trauma can affect later on. And how do you get rid of that kind of trauma, and how do you identify that that person had that trauma while the child in the womb? I mean, how do you know that? How do you extract that?
No, this is a very good question, and things in experience in vitro, which is why one of my key question is to any client who comes in is I always ask, what is the relationship between your parents? Because the relationship between the parents would have told me what the mother went through when the child was in vitro, when anyone is in vitro. And yes, like healing this type of trauma is so ingrained, but it's totally possible. And I just also want to kind of say something positive, is that trauma and trauma healing, it does sound negative, but it's also something so beautiful. Because in my experience, people who have gone through terrible things and an unspeakable amount of, you know, pain in their lives, when they heal and when they come out of it, they are, it's amazing, because their empathy, their power, their sense of peace and contentedness, they literally become beacons and agents of peace. and they start healing other people without even realizing it. And it's actually so beautiful. So I always say, like, when people come in and they say, you know, they've been through so many terrible things, and I said, this has been given, this, you've gone through this experience so you can get over it and then heal other people with your experience. So
That's so
once you
right,
start
Divya.
looking at it like this, it's a really beautiful thing. And you know, it's almost kind of like a blessing. I know people who've gone through terrible amounts of trauma wouldn't say that, but when you get over it, it does become a blessing. Like things that have happened in my life that have not been so great, I have honestly thought that I'm so glad I went through that, because it's because of that that I can be and hold the space for so many people going through things, you know, and it develops a root in you, develops something, a strength in you that enables you to hold other people going through other trauma.
Divya,
So
quickly.
true. That's so true.
Yeah.
Thank you, Divya.
Yeah.
Yes.
So trauma, there is a like a negative connotation for if you have trauma, is something bad or wrong. You know, our culture is such. So you said, I'm talking about people in the margins who have no resources. I'm talking about ordinary people who wouldn't go to a doctor or to some kind of treatment and say, hey, I have a trauma, because there's a lot of social baggage attached to it. So you said first, do a body scan, be aware of how your body is reacting. It's powerful. I do that every time. Then the mere act of observing, you said, is by itself the journey of healing begins. What is the third step for somebody who doesn't want to admit the trauma or who doesn't have the resources? Some self-healing at home.
There are so many YouTube videos. I've personally found the Vipassana approach incredibly helpful to this. But then again, that's just one of the many. But this is just what I felt personally. There are so many videos on YouTube that you can do to kind of do joint meditation or guided meditations. I think meditation is key. It is the deepest impact that you can have on your body, that no needle, no other therapy can ever hope to go. Because for me, the acupuncture is the first step. And then usually in so many cases, people just turn to meditation naturally. Because acupuncture kind of gives them the springboard into self-inquiry. So I agree with you that there is a taboo, but we have to change that, Soraya. We have to change the fact that we don't talk about it, because each and every single living person on this planet has gone through something. And they are then inflicting that violence onto other people in small ways or sometimes big ways, but it's still a way. So we have to kind of, start talking to people, start referring to different therapists, and start making it an open thing to discuss around the dinner table, or not shaming people who have decided to reach out for help. And these are values that we really have to start, developing. But definitely, referring, maybe looking at definitely meditation. And there are many different types of meditation.
So hurt people hurt people.
Yeah.
Hurt people hurt.
Yeah.
Hurt people hurt
Very
people.
much.
Yeah.
Very
I was
much.
just going to say, Sri Lanka as a whole, I used to very proudly tell the Western world when I lived out there, how Sri Lankan people are very resilient. They put up with anything. And I thought this was our pride and joy, that we had the ability as a nation to put up with anything, right? For instance, I would even quote things. I said, when Katrina happened in America, I mean, they brought out the counselors, people died, people drank foul water, they got dysentery and cholera, etc. And this is in the first world, right? And I say, in Sri Lanka, we had the tsunami. Nobody died after the fact, in the sense of drinking bad water or saying, woe is me. They just had, to live, they got on with it and they moved on. Now, what they didn't move on with is the pain, perhaps, Right. And I think I opened my eyes more to this, because I truly believe as Sri Lankans, we are a damaged society. I'm sure people might challenge me on what I have to say, but we are. We've gone through all this trauma of war. We've gone through trauma of racial fighting, and particularly set up by a certain segment of people that only this kind of creating this kind of anomalies benefited only them. But we as a people absorbed it as a whole. So, and this plus point I used to tell everybody about, this ability to be resilient and put up with anything, is also now, I believe, our curse, because we really put up with anything. And we don't fight for what is right. And we don't, do you have an opinion about how, I mean, we as a nation, I think meditation, bringing meditation into schools might help, right? But
Absolutely.
is there anybody who's listening to this program who can say yes and acknowledge, because I believe if you acknowledge something, you're halfway to healing it.
Right.
But if you are in denial, then you don't, right?
Yeah, I don't think there's anyone in this country who hasn't suffered, Carol, and I would agree 100%. Because even if you take out war and the tsunami and the riots and the different uprisings we've had, even if you take all those away, what about the interpersonal stuff? You know, what about the families? What about the school systems? What about the, you know, our governance systems? All of these are trauma-inducing, all of them. So everyone has experienced something. So I don't think you're wrong at all. And I personally feel, and I always tell this to my teenagers who come in, I always say that, you're lucky. I'm so glad that you're learning this now. I think that every single 5-year-old should be taught self-healing. Like, that should be a part of the curriculum. How do you heal yourself when you've gone through the breakups, when you've gone through the, crazy boss, when you've got, like, you can't stop stuff from happening to you. But the best gift you can give your child, I tell this to all my parents, the best gift you can give your child is the knowledge on how to heal yourself when something bad happens. And that could be anything. And definitely there should be mainstreamed in schools.
Sorry to butt in, but there's a question from one of our viewers, says, how about psychological therapies? Does classical acupuncture address that aspect?
Absolutely.
I mean, I suppose it does in a way, right? Because you're healing.
Yeah, but we don't deal, because this is the difference, because psychological therapy insinuates it's just the mind. And so therefore talking to you about your divorce, talking to you about your emotional abuse. But what the acupuncture does is that incorporates the mind and how it manifests through the body. That is the difference, because we don't think that just by looking at the mind, it's enough for healing. We need to look at the mind, how it manifests through the body. So like I said, that child, who was tensing up his throat, it's manifesting now in constant throat infections because he's been clenching all his life. The woman who has always, since the child, she's been clenching her shoulders like this, that's the breast cancer, because the entire circulation to the breast was cut off, and because she keeps clenching herself. So connecting those two is where we come in as body therapists.
Divya, I want to, this morning we all woke up to this news that the President Gotabaya Rajapaksa has appointed Galagodatte Gnanasera as the chief of the task force to study the one law, one country concept. And there is collective trauma in the Muslim community, because we have heard, defying all Buddhist principles of kind speech. We have heard this Thero spreading a lot of hatred and inciting hate. So what do you have to say about collective trauma? What message would you give to us, the Muslims? How are we going to heal as we grapple with this challenge?
You ask the best questions.
Thank you.
We are a non-political show, but there are political questions.
No, but it's a wonderful question. See, what I have also realized through my own meditation practice, and also seeing the journeys of all these beautiful people in my clinic, is that the more you do this type of work and the more you unlock the body trauma, the more inclusive your worldview becomes. Because when your different body, your body is just locked in trauma, and you got a memory here, you got a memory here, everything is in a state of tension. You're fearful. There's a sense of separation to the outside world, right? You're in pain, emotional, physical pain. But the more you unlock all of these traumas around your body, your worldview starts expanding, and then you become less violent in your worldview. And that means less thinking with a less sense of separation, thinking with a less and more with a sense of unity and seeing the oneness in yourself and other people. because it's trauma that separates us. It's trauma that creates the violence. It's trauma that makes me hurt you because I think I'm separate from you. But that if I start healing myself, I see the oneness between you and me. And so these types of one law, one race, one whatever, the separation worldview, this is a collective trauma. This is a collective worldview of trauma. But if we start deactivating the trauma within individuals, we don't need to think like that because we won't be acting from a sense of fear and separation.
So,
Does that answer your question?
I don't know whether we can have a total answer to that question, Soraya, but we've
Does that
had
answer your
somebody
question?
on our panel who's been very quiet all this time, and I'm going to go after you, Selvi. Ask those questions because you've known Divya since the day she was born, and you probably know what her journey was. And can you share some information with us or ask her some questions that she hasn't answered yet?
Thank you, Carol. Yes, I'd like to just look at some aspect which Divya is interested in. That is trauma to the body, right? When a body suffers from an operation, surgery, or an accident, or even physical abuse, the body is traumatized. And I know that that can cause a knock-on effect to give the body certain ailments. I was wondering whether Divya has looked at it and whether she has any answers to particularly trauma created in body because of surgery.
So yeah, I mean that's a good question. Again, I mean, we've been mainly focusing on emotional trauma, but another huge part of my clinic is dealing with trauma as a result of surgical interventions and medication. The simple fact is a meridian is a blood vessel. I hope everyone is familiar with the concept of a meridian. So a meridian is a blood vessel. So the minute you kind of have an incision, or you have a scalpel going through blood vascular systems, you start getting scar tissue. And so when you start getting scar tissue, whole vascular systems start getting blocked off. And so you might have a C-section and you're basically cutting through the entire abdomen. You have a lot of internal adhesions, you have a lot of scar tissue. And then 2 or 3 years later, the woman starts getting migraines, for example, but you'd never link the migraines to the scar tissue. And so they come into clinic and then we talk about it. And then I go through, have you had any surgeries? And that's always one of my first questions. Because I want to see where there's scar tissue in the body and where the body is being cut, if there's been any broken bones, because these all impede circulation. So if you've had a cut through the liver meridian, which is the vascular system that goes and feeds the liver, then you might be expecting liver functions to be showing different readings. Or lower readings, and there might not be anything wrong with the liver, but the circulation there is not as good. So yes, definitely like surgical interventions, and also the level of anesthetic in the body. We're looking at toxin interventions. All of these physical interventions as well have trauma on the body, and that also has to be addressed because that also kind of impedes your health and your well-being.
Right. Soraya, one last question from you.
Yes. So, thank you so much. You've shared such powerful but simple to do, observe and correct yourself kind of information that is so useful to our listeners. So, going back to fear and separation, Divya, I think that's the root of trauma, right?
Absolutely.
So. Yeah.
So we really need to heal this, Soraya, and this is exactly what, and like the fear that our Muslim brothers and sisters are feeling, like that is fear as well. And so imagine what they are doing with that fear to their families. Imagine what they're doing with that fear to their women, their children, other communities. So it's an all across thing. We have to get over the fear in this country as a people and the healing. And when you start dealing with the body memories and that grief and that trauma, you will see automatically our nation will change.
And even as activists, for us, when the other person is on the other side, not on our path, there's a fear and there's a separation, you know.
Absolutely.
To mindfully rise above that is a daily practice, isn't it?
It is, absolutely. And that fear is coming from what, Soraya? It's coming from past experiences, right? It's coming from the past, and that's in the body. So when I meet Soraya, who's from a certain faith that I had problems with 5 years ago, I will then interact with Soraya with that memory. And Soraya will then interact with me with that memory. And then you start the dance. But if I come with you and look at Soraya as a human being and we're having a conversation without any grievance or without any baggage, then our communication will be so different.
Thank
In
you,
the West,
dear.
we say this, the only thing that's real is love. No matter what. Yes, yes. Thank you
I
so
think,
much.
you know, Soraya, I had one last question for Divya, because Selvi and I were discussing this morning, this afternoon, and it's about COVID vaccines, vaccinate, on be a non-vaxxer, as they call them, and how you feel about that, right? So I know from classical acupuncture side of it, you attend to it in a different manner, right? But to me, when I was telling your mom, you know, you can't travel, you can't do certain things, you can't even enter to, as you know, I'm a sportswoman. For me to enter an event, I have to actually show a vaccination, proof of vaccination, before I can even travel to that venue. So for me, it has become like a must do, even though maybe I don't totally believe in it. Do you have, as Soraya earlier said, you know, only thing we know at this time in lockdown, in trauma, again, created by loss of loved ones and sickness, that all we have left is love, right? That's what Soraya was talking about. I mean, all the money you can accumulate doesn't stop you from passing away during COVID, not seeing your family, and being, according to the Sri Lankan rules, cremated within 24 hours, right? You haven't even had the chance to say goodbye to your loved ones. Is there anything you can say to those people out there who have lost loved ones, you know, something that will help them heal this traumatic time of not even being able to say bye to their loved ones?
Thank you for your words, Carol. I mean, this has been such an emotional time for the world the last year and a half. Unspeakable amounts of trauma around the world due to lockdowns, losing people, the fear. I mean, I've known many people who have lost friends over their health choices, as you mentioned, the vaccine, and because some people have decided to do and some people not, and then the fights between them, and that just the emotional trauma from that as well, you know, feeling, yeah, just feeling kind of left out. But what do I have to say? I would say, gosh, it's such a huge question. I would say compassion. Compassion for yourself, first of all. Don't be so hard on yourself. We can't always be the best possible person, although we strive to be. Compassion towards yourself, and then therefore compassion to other people, and realizing that other people are going through immense amounts of things and they're making decisions for certain reasons. And we can't begin to explain what those reasons are because we're not in that position. So I think compassion and kind of cultivating a culture of compassion in our society and in ourselves is important. But I don't know, to people going through all of this, I mean, it's such a difficult time and we're living in unprecedented times, and we just have to be there for each other. We have to love. I think really love is the key thing here, and trying to really overcome our own prejudices and our own fear, and really loving one another with compassion and saying, maybe someone, you know, can't get the vaccine because of allergies. Do we judge them? Or someone needs to get the vaccine to go to work. Do we judge them? You know, we need to look at kind of, you know, be empathetic and most of all, be self-compassionate.
Thank you. We've also had a message from one of the viewers to say an empathy, to have empathy for one another. Quite right, you know.
Yeah.
On that note, thank you so much, Divya Srinivasan. It's a joy to have you on the show discussing this very important subject about classical acupuncture. I think more people will be aware of this after today. and the need for you to start a school here because it's so limited, because it's one clinic at the moment. And perhaps, you to take your work across to other areas of Sri Lanka as well, you're going to have that help, right? You're not going to be able to do all of this by yourself. This Wisdom Wellness program that we started to address holistic approaches to healing as our second session was going to come to an end with today's show. But then we decided, because there's so much of interest towards it, to have our two next shows as well on Wisdom Wellness. That's the 10th of November and 24th of November. So that would be the end of our series. So the second series, at least. Today is the 40th show. So we've been plodding along, since lockdown started last year. And I want to thank our viewers for always joining us and participating, because if we as a panel can bring in experts or even talk about our own experiences, and if we can heal one person at a time, all these bad news that we are absorbing on a daily basis, getting bombarded with social media that's going back and forth, shared over and over again. I have actually decided not to read any of this or watch any of this, because the frustration build up as an activist for me is so hard, because I came to a point where I almost burst into tears when I would get a call at 4 o'clock in the morning with somebody saying, ma'am, they're cutting some trees in this area or destroying this area. And finally, I ended up in Divya's clinic, because out of the blue, a friend of mine called me and said, Toza, I need you to go see Divya now. She just felt that she just had this telepathic effect to say that I was actually struggling. And I was struggling because there's so much bad news out there, and I want to solve problems. I don't like my friends on the panel here. We want to heal. We want to help solve the situation. We want a better Sri Lanka for all of us. And the frustration that whatever work we do is not going anywhere. And the only thing that is helping me at the time is doing the little work that I do to help one person at a time. So to all of you out there, I'm saying, don't think that this is the end of it. You have to have hope for a better tomorrow. And one way of doing that is going out and helping one person at a time. Do not wait for the politicians to change the course. Do not wait for somebody else to do the work. Do not wait for a collective to join in and tell you, say, let's do something. We all have the power to do something to make somebody else's life better, and have empathy and love for one another. On that little bit of preaching, see you next 10th, on the 10th of November. Thank you very much from our panel. Good night, and thank you, Divya. Bye.
Thank you very much. That was very good.
Thanks.
Thank you.
Thank you.